Well, good morning. We're gathered here today on the traditional territory of Treaty 6 and also recognize the Métis people of Alberta who share a deep connection with this land. I'm pleased to be joined today by Leslie Thompson, who is the founder of Pumps for Life, to call on the UCP to immediately fulfill this commitment they made to Albertans living with type 1 diabetes. 6 months ago, the UCP created anxiety and stress for Albertans with type 1 diabetes when they announced their plans to cancel the Insulin Pump Therapy Program. They claimed this cancellation was necessary to make insulin pumps with newer and updated technology available. Of course, there was no reason why new insulin pumps couldn't have simply been added to the original program. The UCP eventually backed down after significant pushback and organizing by Albertans, including members of Pumps for Life, who made it clear just how harmful the UCP's plan to cancel the Insulin Pump Therapy Program would be for those 4,000 people who depended on the program and the many more who will need to join it. After the UCP paused their decision to cancel the program, they made a number of commitments to build a better relationship with people with type 1 diabetes, and I was pleased to see that. In July of this year, the UCP said that they would make newer technology, including newer forms of insulin pumps, available starting, and I quote directly from the press release, as early as possible in 2022. The UCP have yet to achieve that promise, and there are only 11 days left in this year. The UCP also promised that they would work to mend some of the broken trust with type 1 diabetics in Alberta by creating a diabetes working group. The UCP have named co-chairs for this group, but so far have not done anything else. No other members have been announced, and Albertans with diabetes have not yet been told how they can engage with this working group. Frankly, this is simply a continuation of a disturbing trend of disrespect from this current UCP government to the diabetic community. Last week in the legislature, I asked the Minister of Health why commitments to the type 1 diabetic community had not been acted on, and did not hear any real justification for the delay. So I'm calling on the Minister of Health today to explain why he has failed to fulfill his commitments. He must also provide clear details on when people on the Insulin Pump Therapy Program will be able to access new technology and when and how they intend to engage with the Diabetes Working Group. I recognize there's a new premier, but the Minister of Health has stayed the same, so there's no reason why he couldn't fulfill the commitments that he made months ago. At the very least, the minister should have been transparent and upfront with Albertans with type 1 diabetes about these ongoing delays. The UCP has been so focused on their own infighting, their internal chaos, that they've clearly forgotten about their actual job, serving Albertans and ensuring that they have access to the care they need and deserve. Frankly, it's an insult to people with type 1 diabetes who've dealt with so much needless stress, anxiety, and confusion because of these decisions from the UCP government. Thank you, and I'd now like to invite Leslie to say a few words.
Thank you, David. Good day. As you've heard, my name is Leslie Thompson, and I represent Pump for Life, an advocacy group for over 2,000 type 1 diabetics on insulin pumps in the Alberta Insulin Pump Therapy Program, as well as I myself am a type 1 diabetic on an insulin pump. And you know what? When we heard what was happening in July and we got the pump program back and we were told that we were getting newer insulin pumps added to the program, I really didn't think or expect I'd be standing here with Mr. Shepherd so soon, right here before the end of the year. But here we are again. In July, the Alberta government told us that the Insulin Pump Therapy Program was reinstated immediately, which they did. And starting as soon as possible this year, they would be adding newer insulin pump models into the program. Now, our group and type 1 diabetics throughout the province were happy and elated and felt the government finally listened and understood the importance of medical technology, such as insulin pumps, that add to the quality of life for type 1 diabetics, but also keep us healthier. This device is costly, yes, but for the healthcare system, it saves money, as it puts less of a demand on the overwhelmed systems, as these diabetic patients will not be seeking as many services for complications of diabetes or filling our overwhelmed, overburdened emergency rooms. Insulin pump diabetes clinics were also told that these newer pumps would be available around October. Well, it's now December 20th, and there is no news in sight of when these newer pumps will be added into the program. With 11 days left in the year, I asked this UCP government, when will these newer insulin pump models be added to the program? Mr. Copping, where is it? You promised us. We haven't heard anything. What are the delays? Be honest with us. These devices are not a luxury. These are life-saving medical devices. People are counting on these devices. There are diabetics out there on insulin pumps that are out of warranty now because they are waiting for newer models, and no one wants to be upgrading their model to a model that is out of date. You only get a new insulin pump every 5 years on this program. And picking an insulin pump that is best for one's life is a big decision. As I said, your insulin pump only gets replaced every 5 years. And Albertans shouldn't have to be using out-of-warranty medical devices because the government couldn't keep their promise. Not only did the Alberta government promise new model insulin pumps to be added into the program, they told us that they'd be creating a working group to look at how the government addresses the needs of Albertans living with diabetes. Now, as we've heard, co-chairs have been named, but there's been no other news regarding this. And from what we can see, there is no one currently in the group to speak about type 1 diabetes and type 1 diabetics on insulin pumps. And it's time to work together and have a comprehensive group that covers all aspects of diabetes and all types of diabetes, especially us living with it. We need these lived experiences shared to make the plan for the future of diabetics here in Alberta. So I asked the government to add people like myself, a type 1 diabetic on an insulin pump, and other type 1 diabetics to this group so we can provide valuable information to the framework for diabetes within Alberta. And I remind the UCP that type 1 diabetes is an autoimmune disease. There is nothing anyone with this did to get this disease. There is no cure, but there is technology that provides peace of mind and freedom for all of us type 1 diabetics.
Thank you, Leslie, for sharing your experience and speaking on behalf of the members of Pump for Life. Unlike the UCP, an NDP government will not waver in its support to people with diabetes. Not only will we be much more transparent and collaborative than the current government, we will expand and strengthen the Insulin Pump Therapy Program. Now, before I take questions, I would like to take a moment to speak about the situation at the Stollery Children's Hospital. We've heard from several sources within the healthcare system that AHS has either declared or is about to declare a state of local emergency at the Stollery, which would give them the ability to cancel vacations, require mandatory overtime, and take other measures to try and shore up the staff at an overwhelmed hospital. My thoughts are with the families, all of the families, who are struggling to get care for a sick or injured child. And my thoughts are with the staff in the Stollery who have worked tirelessly on the front lines, who I know now are incredibly exhausted. And for sadly, there is no end in sight. These are true Alberta heroes. But it never should have gotten to this point. The UCP has chased healthcare workers out of Alberta. They refused to even debate the building crisis in children's healthcare and instead chose to send the legislature home early. Danielle Smith and the UCP are more interested in pandering to an extremist fringe than keeping kids safe. It's in this context, a state of emergency at a local children's hospital, that Danielle Smith decided her priority was to create a new cabinet position specifically to undermine Alberta's vaccination efforts. Can't make this stuff up. An Alberta NDP government will bring real resources to the front line, work collaboratively with healthcare professionals, follow the science, and end the chaos in our hospitals. We're happy to take any questions.
Thank you. This is just a reminder for if you're on Zoom, it's the raise hand function, and if you're on the phone, it's *9. We'll start in the room.
Mr. Shepherd, could you just kind of explain that to me in layman's terms? What is a state of emergency at a hospital?
So state of emergency basically is recognizing that the current resources at the hospital are overwhelmed or inadequate to meet the current needs. So my understanding is it gives the hospital then certain authorities, things like being able to cancel vacations, require mandatory overtime, and potentially also then compel staff from other areas to come to work in that area to address the need.
How did it get to this point? Can you say they did one thing wrong in particular that led to this?
It's complex, and certainly there is a number of choices that this government has made that has led us to this place. Certainly, throughout the COVID-19 pandemic, we saw the government continually make the decision to act last and act least. It pushed our healthcare system and the folks who make it possible to their limits. So we had exhausted healthcare staff after multiple waves of COVID-19. This government also chose to go to war with physicians, which undermined the access to primary care and worsened the situation that indeed we see in many jurisdictions, but particularly here in Alberta, where a lot of chronic conditions and other things went unaddressed for a number of years, which increased pressure again on our emergency rooms and our frontline health facilities. Then we have the situation now where the government has also chosen to downplay vaccination on a number of fronts. They repeatedly throughout the COVID-19 pandemic refused to have vaccination clinics in schools, despite a long history of doing so for many other vaccines, including the flu vaccine at times. And coming into this fall, indeed, we had the government that was obsessed with their own leadership race, their own internal drama. We had Premier Smith elected on a platform, unfortunately, of appealing to some folks who have fallen prey to conspiracy theory and misinformation and anti-science. And as a result, we have a refusal by the government to really take any significant action. They've instead undermined public health. They fired the chief medical officer of health, replaced her with a part-time volunteer, and had following the resignation then of the two deputy chief minister officers of health. So we have a very muted vaccination campaign. Pediatricians and now the emergency section of the Alberta Medical Association calling on this government to make vaccines more available, to have clinics in schools, to make extraordinary efforts to ensure that they are available to every community, that the access is there, but yet we have little from this government but lip service. As a result, we have situations like this at the Stollery Children's Hospital.
Okay, thank you. We'll do one more pass for questions. Just a reminder, if you're on Zoom, it's raise hand, and if you're on the phone, it's *9.
If we go back to insulin for a second, how many folks are in this spot where they're waiting for their pumps?
I don't have a number of. I don't have a number. There's over 2,000 people in the program, and people have been asking for years for newer insulin pump models, such as the upgraded Omnipod pump and the Tandem pump that work really easily with the CGM, which is a continuous glucose monitor that gives you more control and flexibility over your life and leads to a healthier life. But as for how many people are waiting to change over their pump, there's a lot, but I don't have an exact number for you today.
And just kind of explain in layman's terms, why are these pumps so good?
Insulin pumps are great and just an integral item and device for a person with type 1 diabetes because it mimics what your pancreas does. You can program it to give you different amounts of insulin throughout the day. So instead of just taking multiple shots and guessing, you work with your medical professional to make sure that you have the right amount of insulin that's being given to you throughout the day, throughout all your life. Whether you have activities, then you give some more insulin while you eat, and it just gives you that flexibility. You're not tied to this tight routine that you have to eat at certain times, as well as you can go do sports, you can go do different activities, you can live a more normal life, per se.
We'll just do one more quick pass for questions. Raise hand function on Zoom, *9 on the phone. Seeing none, that concludes our press conference for today. Thank you.
Much for watching, and to learn more, check out albertasfuture.ca.